That's right. I mean, Chinese medicine, as you know, is a most incredible art and a craft and a science. We get to use what's been honed over thousands of years and apply it to diseases in modern day and can make a real significant difference. So it's very rewarding, of course, as well as keeping the wolf from the door.
I'm Michael Max, and this is Geological, the podcast that curates East Asian medicine and methods through the power of conversation. I don't know anything. I frequently hear this from students and new practitioners. You know what? It's not true. What's more, it doesn't help to hold ourselves small, just like it doesn't help to puff ourselves up. You do know something, and that something is likely part of what led you to acupuncture school and kept you there. It's what led you into a practice and all the paths followed that took you to someplace unexpected. Often enough, the problem isn't that we don't know, but that we think we do. Getting free of the traps of possible or not, cultivating a fertile sense of not knowing that opens an inquiry into new understanding, that is how to steer when navigating new territory. Because, for sure, there are things to know and processes to understand, but if you don't acquire the knowledge for doing the work, then you can't do the work. But at the same time, avoiding the limits that arise from the last time that something worked well, that kind of certainty, it's best held lightly. For sure, you need the mind of an engineer to work out certain herbal formulas. You need the broad, inquisitive, and observational mind of an evolutionary biologist to explore novel terrain, along with the discipline to hold your own feet to the fire of learning, especially when you're missing some key point, and clinic generates more discomfort and confusion than understanding and ability. Learning medicine is hard, but then so is learning to cook well, or play a musical instrument with fluency, or figure out how to disagree with someone that you care about in a way that strengthens the relationship. Lifelong learning sounds good when discussed over coffee, but the practice is another story. It's a process of constantly reassembling what you think you know as your maps of the world get redrawn by the experiences that you have. It's a grueling practice, and yes, it can leave you imagining that you know nothing. But that is not true. It's just that knowledge and what it does to you can be disruptive. The Chinese say, 活到老,学到老, meaning live to an old age, you'll be constantly learning. Sometimes I take this phrase as a reminder of the opportunities that come with living long enough to have some perspective. Other times, it feels like a threat. One thing for sure, there's always something new up around the bend. And again, it doesn't mean you don't know anything, but that your knowing, often enough, requires some remodeling along the way. Learning how to learn and developing the capacity to recognize mistakes and use them in a way to correct your errors, it's essential to the practice of medicine. Especially when it comes to practicing herbal medicine, you'll need a clear idea of what's going on before you can craft a targeted, effective, and safe prescription. And fortunately, we can more easily these days access the experience of doctors from the past and, for that matter, doctors of the present. In this conversation, I sit down with Mazin Al-Khafaji to discuss treating dermatological problems with Chinese herbal medicine. As Mazin points out in this conversation, because the patient's problem is showing up in plain sight on the surface of the body, you don't need to deduce an internal pathomechanism because it's showing up right in front of you. And if you know how to read the story on the skin, you can be very helpful to your patients. Effective herbal formulas have a beauty in them in how they match the patient and, in so doing, shift their physiology. It is a remarkable medicine. We'll get into all of that and plenty more. Stay with us. These conversations come to you through the generous support of our sponsors and members. Blue Poppy, your new one-stop shop, has speedy shipping options on everything that you need for your clinic. It's Women's Health Month at Mayway Herbs. Check out their new website for learning resources on helping women with herbal medicine. Are you a creature of habit? How about making a change that helps your patients and the planet with AccuFast needles? And later in the show, raising your fees doesn't have to be a difficult process. Jane has helpful suggestions on making it easy and effective. And finally, have you considered that having a thriving, profitable practice is one of the most healing things that you can do? Julie Bear-Don't-Walk has, and she can help you do something about it too. Do be sure to visit the sponsors page on the Qiological website to take advantage of all the special offers our terrific sponsors have for listeners of the podcast. Picture this. Your clinic is buzzing with patients, and then you realize that you're down to your last box of needles. No need for panic, because Blue Poppy, your one-stop shop for all your acupuncture needs, they ship orders received before 3 p.m. on the same day. With a quick visit to Blue Poppy's website, you can order premium needles, herbal formulas, and that special Dr. Bob's oil that your patients love. Blue Poppy understands practitioners can't keep patients waiting. That's why they strive to get you what you need when you need it. From high-quality Chinese herbs and formulations to acupuncture supplies and clinical essentials, Blue Poppy has served practitioners for nearly 40 years with products that meet the highest of standards. Discover everything Blue Poppy has to offer by visiting www.bluepoppy.com, and don't forget to subscribe to their mailing list for exclusive offers and more.
Hi folks, I'm Yvonne Lyle, president of Mayway Herbs. May is Women's Health Month, and as a women-owned and women-run business, we especially love how Chinese medicine can support wellness through every stage of a woman's life. So in this month's newsletter and podcast, we're covering topics like PMS, pregnancy, menopause, and osteoporosis. We'll share expert insights and effective treatment strategies you can put to good use in your clinic. Our Plumflower brand line includes herbal tea pills, tablets, extract granules, and organic herbs, all of which you can find on Mayway.com. And where you can also find articles, videos, and other resources to support your practice. Since 1969, Mayway has been a trusted source for high-quality herbal products. In these challenging times, please know that we remain committed to keeping our products accessible and affordable so you can take care of yourself and your patients. As always, thank you for supporting Real Chinese Medicine.
Daily habits and routines feel comforting, familiar, easy, automatic. That's the power of repetition. You've worked out the kinks and can do it with your eyes closed. But what if you shook things up? What if you ditched the old routine and tried something new? Hi, I'm John Sten. I've practiced acupuncture for over 30 years, and together with my wife Kelly, we created the world's first eco-friendly acupuncture needle. The AccuFast earth-friendly needle system cuts your packaging waste by 60 to 90%, depending upon your needle type, speeds up your needling, gives you more control, and best of all, while you're healing patients, we plant a tree for every 2 boxes your clinic uses. Thousands of acupuncturists have already made the switch. In just the last year, they've helped plant over 16,000 trees. Since we started, that number has grown to over 50,000. So break the routine. Be the change. Visit AccuFastNeedles.com. Your patients and the planet will thank you.
Mazin Al-Khafaji, welcome to Qiological.
Thank you, Michael. It's great to be here.
Delighted to have you. We got to meet each other a few months ago. I was in New York City. You were in New York City. I was taking your class on dermatology. And I have to say, I don't usually plug things here on the podcast, but man, it was amazing. I came back to clinic after that 2 days studying with you. I looked at skin in a whole different way. In fact, I was able to sit with some patients that never mentioned a skin problem. And I'd never noticed a skin problem. And I was like, oh, what about this little thing on your hand here? And it was really quite incredible. Very, very useful. So I'd love to talk a little dermatology here with you today.
That's what I'm here for.
It's funny. When I first came across your name, it was on the acupuncture book that you helped to write. It wasn't for dermatology. It was for acupuncture. I'd like to first hear a little bit about that project, because that book, I think, is in everybody's library, and it's a tremendous resource. Tell us a little bit about that.
When I first started studying acupuncture, it was back in 1979. I did a 3-year course. And actually, just before I started studying, I studied on Chinese language, classical and modern language. After the 3-year course, I went off to China and spent 4 years studying herbal medicine specifically. Really, I loved acupuncture, but herbal medicine was my true love. After I returned from China in, when it would have been 87, I had to practice acupuncture in order to make a living. Herbal medicine was pretty much unknown in those days in England. But I was really focused on herbal medicine. That was my absolute focus. My friend Peter Dedman was approached by Churchill Livingston. He was established as an acupuncturist then. And they asked him to write a book on acupuncture. As it happens, we ended up self-publishing. But he asked me if I was interested in the project. So I used my Chinese skills, my language skills, to translate the works on acupuncture. We then sat together and compiled the text based on those translations. So that's how it was, really. In fact, pretty much at the same time or soon afterwards, in the late 80s, early 90s, and this leads on to my interest in dermatology, I was approached by some conventional dermatologists in London, who became very interested in Chinese medicine for the treatment of atopic eczema, since they saw some really spectacular results using basic formulae for treating this really the most recalcitrant and difficult kinds of atopic eczema. So I worked with them for a while, and as a result, started getting a lot of dermatology patients. So that was, as I say, late 80s, early 90s. And really, I've not looked back since then. My interest in dermatology is sprouted other interests, specifically in inflammatory disease, autoimmune disease, and allergic disease. And that's where I spent really the last 36 years honing my skills in that department.
Yeah. It's funny, isn't it? You get an idea to go do something, and it takes you down a certain road, and that takes you somewhere else. And then now you're prepared for a strange opportunity, like conventional medicine doctors coming to you and wanting to talk about Chinese medicine. What was your initial interest in Chinese medicine? I mean, 1979, that's a little bit early.
Yes. Actually, I'd first come across acupuncture.
Mazin, what were you thinking?
Yes. I was a youngster. Actually, the very first time I came across acupuncture was when I was a 16-year-old or 17-year-old. I saw one of these beautiful acupuncture charts from the Ming Dynasty. And I got inoculated like an allergy. I saw it once. It was the very first time I came across anything to do with Chinese medicine. The second time I came across it, a couple of years later, I was hooked. I knew, before really I knew much about Chinese medicine, that I was going to study Chinese, which is what I did. I was going to study acupuncture, and I was going to go to China and study Chinese medicine. And it turned out exactly the way I'd anticipated. I mean, it could have gone wrong, but as it happens, it didn't. I'm very grateful for that focus because it's meant everything to me.
Yeah, you've had a whole life and all the people you've been able to help.
That's right. I mean, Chinese medicine, as you know, is a most incredible art and a craft and a science. We get to use what's been honed over thousands of years and apply it to diseases in modern day and can make a real significant difference.
I think so too.
So it's very rewarding, of course, as well as keeping the wolf from the door.
Yeah. You know, as more and more people use Chinese medicine, as it becomes not a strange thing, but to some degree integrated into Western medicine, it seems to me there's the possibility of losing some of the, how do I say, uniqueness of it as we try to fit it into Western medicine. And yet, here you are with your work, very much leaning on Chinese medicine all by itself. And I'm curious to get your take on using that tremendous tradition and the amazing things that herbal medicine can do, and how you work side by side, not necessarily fit in, but work with the conventional medicine. Let's get your thoughts on that.
Well, you know, I had a lot of good contacts with conventional doctors in Europe and also in America. Over the years, this has been the case. In Europe, particularly originally in the UK, with those studies that I mentioned, where it launched dermatology, or it launched Chinese medicine in the UK because the results were so spectacular and proven from a Western perspective using a double-blind crossover trial. But really, it was also very limited in many ways because we were fixed with one formula and you had to choose the patient to suit the formula. So there was no way these studies could accommodate Chinese medicine's sophistication. But really, it demonstrated efficacy without question of a doubt, lack of toxicity. So from that point of view, actually the doctors who ran those trials recognized very quickly that they were working with a very weak model because all they had to do was choose the patient to suit the formula. And after that, they couldn't really manipulate the formula further because they had no understanding of Chinese medicine. That was one of my jobs, actually, was to treat patients who'd not responded to a standardized formula. And by making adjustments, I could demonstrate that actually those were relevant and made a difference to the patient. I now have good contacts in Germany and Switzerland, particularly with conventional doctors, and also in the US, particularly with Shou Min Li, the doctor who's done a lot of good work on allergies, treatment of allergic disease and asthma. She's published widely. So really, any way of examining Chinese medicine that's fair to Chinese medicine, in other words, allows it to use the methods that it has developed, will show great efficiency in treatment because it really does work. Time and time again, you can see that. And not only in the short term, what I've found over these decades of practice is that you can resolve many, many cases or change the intensity of the disease so that it's livable with, or really eradicate it completely, as long as people maintain a reasonable standard of lifestyle, eating well, sleeping well, and so on. Then, otherwise conventionally difficult diseases to treat, they can be sent into the long grass very effectively.
It's always been interesting to me with the Chinese herbs that we have the potential to change a person's physiology, not just get get rid of symptoms, but shift the physiology in a way that is significant enough that they can be symptom-free, or maybe not symptom-free, but certainly living a much more comfortable life. And again, it's not coming from just taking care of a symptom. It's coming from the physiology being fundamentally different.
Yeah, that's absolutely correct, because, we might enter and understand how to tackle a condition by examining symptoms and signs. But really, that leads us to resolving the issue at a deeper layer, restoring an equilibrium, really, which is in many ways a birthright. We have the wherewithal. People take it for granted that we wake up in the morning and things work, and you eat and you breathe, and you can maintain things in that way. Actually, for disease to arise, then these significant, substantial factors that maintain life are disturbed. Now, Chinese medicine understands that you can restore that equilibrium if you approach them the right way. So I see this all the time. If a patient comes in with covered in eczema, let's say, then the way I see it, there's 3 phases to treatment. First phase is to drain that excess pattern, that inflammatory pattern. Mostly, when it comes to eczema, it's draining heat from a variety of places in the body, whether it's the qi level or the blood level, the yin level, wei level. Once that is achieved, then the eczema will clear. But if you abandon the patient at that stage, then things will just return. So it's necessary to segue to what I call the harmonizing phase, which is really slowly removing the medicinals, whether they're bitter or acrid ones, so that you can substitute them for ones that are there to stabilize, in effect, the immune system, if we mix our metaphors. And when that's successfully achieved without a relapse, then mostly you can tonify to secure the changes achieved. And I have many, many patients over the decades who really have seen an end to their eczema or their psoriasis or whatever it may be, using these ancient and tried and tested methods.
Mazin, this makes a lot of sense to me. And it makes sense because in some ways what I think you're talking about is homeostasis. It's an idea that I think all of us are familiar with. It's an idea that conventional medicine also has a good idea about. I know that at a certain point in my career, I conflated homeostasis with what I'm going to call proper functioning. It's possible for people to have a homeostatic balance that is dysfunctional. Homeostasis doesn't mean health or well-being. It means homeostasis. It means whatever is in place wants to stay in place. And so you can have a very strong homeostasis state in play with a disease condition. And the body, we have this idea, the body wants to be well. Yeah, to some degree, but the body also wants to be stable. And if it's a choice between well and stable, it seems the body will choose stable. It's like bad habits, all kinds of things. And so when I hear you talk about this approach here, first you take away the excess. Well, that's going to be a big relief. But that's not enough, because the homeostatic balance is probably still going to want to go back to what it's used to. And so you need that phase of harmonization, to bring it to a different place, and then the tonification to secure it so that it's stabilized.
Yes, absolutely right. That's exactly how I think of it as well. Actually, it's quite extraordinary that sometimes it strikes me as quite extraordinary how people maintain some sort of homeostasis, even though it's not a desired state, and yet still manage to live a longish life. But this is an unhealthy life. So yes, what we're after is to maximize really the the proficiency of the body-mind system, so that it can maintain that state which is optimal. And of course, like any living organism, if you get close to that, then it's much easier for that to be continued. So I'm not a surfer, but when you see a surfer riding a wave, if they're sitting on the wave in the proper way, then it's effortless. If they have to swim to catch up, then you put a lot of effort in and you don't get very far, or you just maintain that homeostasis, as you say, but it's not a desired state.
Yeah. It sounds like recently you're also very much looking at inflammatory disease, which makes sense because when I think about dermatological conditions, most of them are inflammatory in one way, shape, or form.
Yeah, totally. Actually, the way I see pretty much all diseases are inflammatory. I mean, certainly the conditions I see a lot of autoimmune conditions, particularly ulcerative colitis and Crohn's disease, Graves' disease, Hashimoto's disease, rheumatoid arthritis, a lot of rheumatic diseases. Really the same principles apply, though of course we use slightly different compounds, ingredients, and there are different priorities. But in essence, in most of these conditions, you first have to gain control over the manifestation of that disease. And you need to be able, of course, to see the change quite clearly. It's not haphazard. If somebody comes in with ulcerative colitis and they have diarrhea 15, 20 times a day with blood and mucus, abdominal pain, fevers, joint pains, ulceration of the mouth and tongue, these are all very common. And really, in my experience, Chinese medicine can control that within a few days, really equivalent to the efficacy of prednisone. No question about that at all. I've seen so many cases by now. So really, Chinese medicine's concepts, if they're applied correctly, are extremely powerful. And once you've secured that first state, once you've put the fire out, and mostly it is fiery, then it becomes really, I'd say, a more skilled job to manipulate the situation and abandon the bitter and the acrid ingredients and substitute them for ones that are able to restore and soothe and replenish the body, so that if patients maintain a reasonable lifestyle, then they can have every expectation in many of those conditions, such as colitis, not to have a relapse. Or if they have a relapse, it would be due to something that's identifiable, and they need to just make sure that their lifestyle is commensurate with their condition. So, it's not necessary, as is the case in modern medicine, to continue to suppress immune function, but rather to restore the immune system to a stable state that can self-regulate.
That makes total sense to me, given what I know about Chinese medicine, or at least what I think I know about it, certainly the principles involved. You just said something that really got my attention, which was you could take something very, full-on flare with colitis and get results with herbs commensurate with what people would get with prednisone. Now, I believe you. What I find really interesting, and I'm sure you ran into this in China. I know that I did. And I think we hear this a lot here in the West as well. There's this idea that Chinese medicine is for chronic conditions and things respond slowly. And Western medicine is better for acute conditions where you need for things to respond more quickly. I remember hearing this a lot in China, because I spent a little time there as well. And I kept thinking to myself, well, it depends, because if you get the right herbs in the right condition, for the condition, especially for things like a respiratory infection or something, you should see results pretty quickly. And so I'm curious to know, I'm curious to know your thoughts more about that. And I'm going to ask you too, are you familiar with Eric Karshmer in the book that he wrote recently?
No, I'm not, but I'm always interested in good books. So tell me a
Yeah.
bit more.
Okay. So this is just a little side note because I would like to get into this a little bit. He went to China as an anthropologist to study Chinese medicine in the I want to say the 1990s, I think. And he ended up getting so interested, he decided to study Chinese medicine. So he's an anthropologist and a Chinese medicine doctor at this point. He's got a book out called Prescriptions for Virtuosity, and it's a fantastic look anthropologically and sociologically at how the medicine changed from being used quite often and quite effectively back in the Republican era for acute conditions to becoming the medicine for Manxingbing, right? For more chronic conditions.
Chronic disease.
I think a lot of us here in the West, we have cotton to that idea. And we often believe that, oh yeah, we can treat the chronic stuff, but we can't necessarily treat the acute stuff. And I think that's a misconception. I think it's, yeah, so this is just a long way of coming around to, I think it's a misconception that we can't treat things quickly. And you have experience with this. So for the listeners out here who may not understand, wow, I could get results commensurate with prednisone. Tell us more how to think about that.
Yes, not only that, I'll tell you. So it's really, by now, I see a lot of patients with colitis. I mean, I'd see half a dozen or more patients every week, and I see patients typically every 4 or 5 weeks. And it's quite common, in fact, because there's a long waiting list. If a patient phones up with ulcerative colitis, then they're fast-tracked. I will see them that day or the next day, even if I don't actually have to see them face-to-face. I'll just give the details. That's how confident I am to be able to change their state. Actually, if you look at prednisone or prednisolone, as it is in the UK, a recent study, a big study, demonstrated that a patient with ulcerative colitis who gets a typical prednisone course, which is 40 milligram, after a week tapering by 5 milligram, those patients have twice the relapse rate subsequently compared to patients who've not been treated in that way. And I see this in my practice all the time. So as I say, it's almost invariable that a patient, you get sometimes some very unusual cases, but honestly, 90% plus, 95% of patients prescribe the correct ingredients. You can control that diarrhea and bleeding within a week to 10 days, and usually more rapid. So after a day or two, things have settled, and then by a couple of weeks, you need to start changing the formula and distance yourself from more bitter ingredients. And as I say, head towards the harmonizing phase. So yes, I agree with you. Chinese medicine is very effective at treating acute phase disease, but you have to get the right approach. You have to marry the patient's symptoms and signs to the right formula. And that's what Chinese medicine is. It's really a nuanced, sophisticated medicine. And if you know how to use those methods, then results can be extremely fast. I mean, the same thing with eczema and psoriasis. These are the big other diseases I see. You should be able to control changes that are clearly demonstrable within a very short period of time. And you know, patients who come in, typically they forget how severe their eczema is or their psoriasis. I take pictures of every patient that comes in. I have a little studio room in my office. And after a few weeks of treatment, sometimes patients say, well, I don't think there's any change. So I then dig out the pictures and show them. And they're astonished how how remarkable the change has been, actually. So, yeah, there's no question. Properly applied, Chinese medicine is very powerful medicine.
This episode is brought to you by Jane, the clinic management software that honestly just makes running a practice easier. Let's dive into something that's never easy, but sometimes necessary: raising your fees. It can feel awkward, right? But here's a tip that can really help. Consider offering flexibility to your patients as you introduce the change. When patients face new fees, it's natural for them to feel uncertain or concerned. That's where flexibility can really make a difference. Offering options like a phased increase, suggesting a payment plan, or even taking a moment to talk things through can help to ease the transition. These thoughtful gestures show your patients that you're listening and care about them, which strengthens the trust you've worked so hard to build. If you're looking for more ideas on how to navigate these kinds of changes, head to frontdesk.jane.app and check out the article, How to Tell Clients You're Raising Your Fees. One last thing, if you're ready to give Jane a try, you can use the code CHIOLOGICAL for a 1-month grace period on your new Jane account. You just bring something up that I noticed when I first got out of school, and it drove me crazy, which is that you ask patients how they are, and they're like, maybe a little better. About the same, maybe a little better. You hear this a lot. Oh, I'm not sure it's working. And what I found when I heard, oh, maybe better, not sure, it was either nothing had changed and they're trying to be nice. Oh, yeah, a little better, right? Or something had changed dramatically and they actually had forgotten about it. I think we've all had the experience of people coming in with back pain or knee, whatever, musculoskeletal thing of some sort, or their sleep is terrible, right? Or they wake up to pee 6 times a night. And you ask, how are you? Not ask, how's your urination? Just like, how are you? Right? And they're like, about the same. And then you ask about the urination or the back pain or the this or that. And they go, I don't have that. Mm-hmm. And it was right at the top of their intake form the first time they came in. It's as if there's a kind of amnesia that people get about having been ill. Have you noticed this? I mean,
yes,
clearly you have, because you're taking pictures.
Yeah, that's, I would say, universal, and maybe not an unhealthy trait, because when people get better, they forget about their disease. That is definitely so. So actually, I will qualify that a little bit. So typically, if a patient comes in, and let's say they're covered in eczema, and you'd expect to see significant change within 3 or 4 weeks of treatment. So they'll typically notice that, but subsequent to that, at week 8, let's say, they say, oh, I don't think much has changed now, and they want to impel you to do better. But it's understandable that they kind of forget what it was like, and really they're shocked when you see them, the original pictures. So, yeah, I think it's fairly common. But that's one of the real advantages of dermatology, is that there's nowhere to hide, not for the doctor and not for the patient. Because if you take a picture of the condition, then you're working with that as a background. You need to resolve that condition. And that's a real advantage, I would say, in treatment of skin disease or very acute disease such as colitis. You can measure things very precisely. If it's something more ambiguous, it's a kind of state of mind that's not quite secure or something like this, then it's more difficult to pin it down. But the advantages of dermatology, actually one of the many advantages, I would say, other ones being that you see the disease manifest on the skin. So you get to know what damp heat looks like, or what toxic fire looks like, what heat of the blood level looks like, and so on. In fact, I would say that specializing in dermatology over the decades has led me to be a better doctor of Chinese medicine, because I can more clearly visualize other components that otherwise are not there to be seen.
And because it's there on the skin and it's there in front of your eyes, you can see very directly what's going on. For things that are less visible, we have to rely on the tongue and we have to rely on the pulse and reports from the patients about what's going on. There's all that. One of the things I found very interesting in taking your class was how tongue and pulse many times really were not that helpful in treating what were very, very severe conditions. So obviously severe conditions. You look at the skin, clearly it's there, but then you look at the tongue and it's like that. It was unexpected, I should say, in many, many cases. I found that very surprising.
Yes, the way I see the tongue and the pulse, really, they're like other symptoms and signs. You can't be a slave to them. You can see people who might go through a process of a differential diagnosis of pattern type in great minutiae. And at the end, they look at the tongue and all of that knowledge that they've amassed is thrown out of the window. And they say, oh, well, no, the tongue is pale, therefore all of that stuff that shows heat and toxin and dampness and is irrelevant. And really, they miss a trick, in my opinion. I've convinced myself over the years, because I've taken pictures of tongues and skin. I have thousands, tens of thousands of pictures. And I did a lot of my study via studying those images. The tongue can be very useful, or it could be irrelevant. There's a saying actually in Chinese medicine that you take the tongue and the pulse as primary and you ignore the symptoms and signs. And there's the exact opposite saying. So you ignore the tongue and the pulse and you take the symptoms and signs as primary. Really, it boils down to a superior doctor knows when to ignore certain things or when to tuck it away for another day. Let's say the tongue is now irrelevant because you can make all sorts of extrapolations. Some people say, well, it's on the skin, therefore it's not manifesting on the tongue. And I think there is some truth in that. For example, I pay much more attention to the tongue in digestive disease than I do for skin disease. I mean, I'll always look at the tongue and always feel the pulse and try and marry the whole thing together. But you get a lot of ambiguity. There's no question about that. Things aren't as smooth and easy as people might imagine.
No, it's not. And here's something odd that I've noticed. I don't work with digestion as a specialty, but I get my fair share with people with colitis or various digestive issues. I have had patients, and they're coming in with a colitis diagnosis. I'm expecting to see a tongue that's probably red, it's probably greasy, it's probably showing some heat and some dampness. And the weird thing is, Mazin, if I was just looking at the tongue and trying to guess what a person's problem was, with these people, I would not guess digestion because their tongue looks pretty good. I found that very, very interesting, how much it didn't match what I expected to see. And this raises another question for me as a practitioner, which is, how often am I looking at signs and symptoms and then making up a story based on what I think I'm supposed to see, as opposed to really getting what is going on for a patient so I can help them?
Yeah, you put your finger on a very important point, and something that I've struggled with as well over the years. So what you say is completely correct. I mean, just before Christmas time, I had a patient with a severe colitis, and the tongue was really insignificant as far as the presentation. So the patient had, 10, 15 times a day diarrhea, tenesmus, blood and mucus and pus and night fevers. These are very classic presentation. And yet the tongue looked pretty normal. I mean, I completely ignored that, obviously. And the patient got bitter draining medicines. And then within a very short period of time, they were better. I've actually, since then, I get email and maintained treatment and moved away from the bitter ingredients slowly but surely and substituted for other ones that are more relevant. So I think, it's very important to recognize the manifestation that the patient presents with and treat that. And you should have your answer pretty quickly. If you've done the wrong thing, then you're not going to get a result. And above all, medicine is practical. We need to be able to achieve the change that we're after. Otherwise, any pontification or any theoretical background is just so much theory. Theory should serve practice, and practice should be informed by theory, but you can't be a slave to one or the other.
Yeah, for sure. And all it takes is a little bit of practice and recognizing, hey, here's a good idea. Oh, it doesn't work out, to help correct the errors in the forest of medicine, so to speak. There's that. I suspect people who have very acute issues, they've got that, 15 times a day diarrhea or the skin incredibly inflamed. I would expect that they should see a result faster than not if you're on the right track. As long as you've got the right medicines and the right dosage as well. I suspect you're dosing these at pretty high levels. Is that correct?
Yes, my training was in China where doses are higher. And absolutely, not only the formula has to be correct, but the dose has to be correct. And most patients don't hang around. If you're not going to treat them so that they see a change quickly, they're not going to continue the treatment. It's expensive and unpleasant to drink and so on. They need to see the change. I guess my doses are high. Yes, they are high. And also I use these cooking machines that accentuate that. So you can get more extraction by cooking under high pressure. So that definitely adds and helps. But it's always also been the case with me that in order to proceed to progress and understand how it is that manipulating a formula ends up making changes in the patient, you have to move quite fast. If it's slow, then it's very difficult to see that it was your intervention that caused that change. I recall in the first 10 years of my practice, I demanded from myself that I could be convinced that it was me who was making these changes, that by prescribing these ingredients and by changing an ingredient, I will be able to see the change occur in the patient. And I'm pretty sure if I use small doses or if I use granules, I'm not a great fan of granules, then those changes will be much more difficult to detect, or they will take much longer to achieve. So then it makes it very difficult to know that it was your intervention that created that change. Does that make sense?
That makes a lot of sense. And what's more, I think that's not a bad standard to hold ourselves to. Yeah. I remember as a student how much courage it would take to actually come up with a diagnosis and then go straight at it with everything that I could muster. Because if I was wrong, I could make people worse. And there certainly is an element of that I think all of us have to go through, that kind of development of being able to diagnose, being able to treat directly, not cover our bases, not a little bit of this, a little bit of that, but really focus and aim the treatment at what we think we see. If they get better, it's from the treatment. If they get worse, well, we've learned something. Sometimes people come in, and I've done this both with herbs and with acupuncture, where I've made people worse, right? It's part of learning to be a practitioner. And it's kind of funny too. People ask, well, does acupuncture work? Well, yeah, it does. How do we know? Well, it made me worse. It does something. I've had those experiences, right? And we laugh about it a little bit. Hopefully I've got a good enough relationship with the patient that okay, now we know what not to do. Let's do what might be more helpful. That I think that's part and parcel of becoming a practitioner is having the toolkit well enough in hand that we can apply it, and then holding ourselves to that standard of, yes, what I did helped you, or yes, what I did not help, but now I know more about your condition and we can turn that around. I don't know any other way of learning besides going through some of that. If you got shortcuts or ideas about that?
Well, of course, to learn from somebody who has experience will help you achieve those shortcuts. I can give you an example. One of the features that you get with eczema patients, atopic eczema. So there are many different kinds of eczema, but now we're talking about atopic eczema, the most common form. One of the common features that you see is that they don't sweat very much. In fact, despite vigorous exercise, they don't sweat. So that means something. It means you need to include ingredients that will vent the surface. And this comes straight from the Wenbing tradition, where you're not using warm acrid medicinals to cause a sweat, but you're using cool acrid ingredients that encourage the rash to the surface and open up the sweat pores to allow that heat to come out. Let's say a patient comes in who has no sweat, has widespread eczema, let's say in this case, due primarily to heat at the blood level and the yin level. If that same patient sweated, then you better not use some ingredients that will otherwise be absolutely essential. If that same patient who doesn't sweat, also suffered with constipation, then in that instance, if they don't exhibit signs of heat in the afternoon, then you shouldn't purge, but you should encourage movement of the bowel using medicinals such as Nyobangja, which actually does exactly that. Togen in Chinese, this encourages the rash to the surface. If, on the other hand, the patient came in and they did sweat and they suffered with constipation, then you're better off using Dahuan. So there are many, many such shortcuts that you just need to learn. And if you have somebody who's got that experience, who can tell you, when you see this, that, and the other, then do this. Once you do it and you're actually able to see the change, you'll never forget that. If you've managed to make that link and you've created a change in the patient that endures, then you've learned something very valuable. So this kind of generic understanding of Chinese medicine is not, it's the first base. It's what you learn when you're a student. But really, most of the learning happens in the decades that follow that. And especially if you focus on particular types of conditions, because you hone your skill in that way. So what I've just described, for example, about atopic eczema, doesn't apply to psoriasis. You have to learn a whole other set of principles, which can sort of overlap for sure. But really, you need to know that when you're cooling blood in the case of psoriasis, then you should think of somewhat different ingredients to cooling blood in the case of eczema, or with damp heat, or with toxic heat, or whatever it may be. So really, these conditions are much more specific than a kind of a generic understanding of what Chinese medicine tells us.
Mm-hmm. So the principles hold true. Oh, there's heat, you need to clear that. But then you have to become more nuanced. What kind of heat and what kind of person?
And where is that heat? Absolutely.
And where is that heat? Yeah.
Yes, that's very, very important. There are so many examples like this that really have come through the ages, that are absolutely essential if you are going to achieve good results in practice. So if we carry on, I think I love to teach through example. That's why dermatology really suits me, because I can show pictures of the patient as they came in. I can show pictures after 2 or 3 weeks of treatment and see how changes have occurred. And then subsequently, every few weeks, you can see what has happened in response to the change of the formula. So let's say a patient comes in with eczema and they also have cold extremities, which is quite a common one as well. They have rujie. In Chinese, this is heat reversal. If they have that, this is a sign of heat, even though their hands and feet are cold. You have to question them further. Do you have yellow urine, for example? Yellow urine is not only an indication that the body is trying to expel heat via urination, but it's also a sign that the yin is being damaged. So when you focus on that, you'll need to activate urination, but you have to be very cautious, because doing too much of that will create further damage. And this is really clinically very relevant. So for example, when you're faced with a patient with this kind of eczema, with cold extremities and dark urine, then you have to question, do you feel hot during the day? How much heat is there present? Do you experience agitation and restlessness? Do you have insomnia? All these add to the amount of heat that there is present. And your clinical judgment should be, in this case, what I need to do is to use bland diuretics, and I need to couple it with ingredients that are protective to the yin. If, on the other hand, a patient is more robust and the heat is extreme, even though the yin is being damaged, you might rather use bitter diuretics because the results are faster. So it's all about judgment. And the more experience you have in one field, the more you're able to see that just by observing some very simple signs or questioning the patient in very specific ways.
And like you said, with certain conditions, once you see it and you've treated it and you know how that works, it makes it easier the next time around.
Oh, yes. No, most certainly. And if you've had the experience of, as you say, if you've made a mistake, that is certainly a way of learning. But if you've had a success and you've discovered why that success has occurred, then that is, you'll never forget such a thing. In my early days, I mean, I still do that now, but I will look at the pictures of the patient and say, well, why hasn't this worked? What am I missing here? And by making alteration to the formula and creating a change that manifests as a clearing of the skin, then you've learned something really, really valuable. And really, that's Chinese medicine's cumulative experience. That's what we do when we study classical texts and clinical experience of veteran doctors.
Having a thriving, profitable practice is one of the most healing things you can do as a healthcare practitioner. Because a robust business is the ultimate expression of vital qi, and that's the heart of our medicine. I'm Julie Bairdontlock, and I help practitioners grow nourishing, profitable, authentic businesses that embody the generative cycle of Chinese medicine. This isn't about all yang all the time. It's about expanding your own internal capacity, growing collaborative relationships with your patients for ethical patient retention, and marketing as an extension of this medicine, not a necessary evil. You already know that everything is connected in your patients' lives and bodies. The same is true for your business. When we align your systems, your schedule, your pricing, and your offerings with you, we create flow, which means more spaciousness, more impact, and more joy. When you are in the flow, fully resourced in terms of chi, time, and money, your business becomes a source of healing, not just for your patients, but for you. Let's grow something rooted, radiant, and real. Visit lifeflowconsulting.com to learn more.
I've heard it said that in learning anything, of course, we can learn it on our own. But if we've got a teacher to help us avoid the mistakes, we can go a lot further, a lot faster. I had a teacher when I was in school who would say to us, you know that you know an herb or a formula when you've used it and it's worked, and you've used it and it hasn't. And in both instances, you know why.
Yeah, that sounds pretty sound. Yes, that's pretty good.
That stuck with me a long time. But it takes time, and it takes experience, and it takes paying attention, and being willing to look at, where have I fallen short with this? Because if you're not seeing the clinical results, somewhere we've fallen short.
Yep, it all boils down to that in the end. As I say, the theory has to serve practice. And practice can be informed by theory, but you can't be a slave to that. You have to be able to see the results. And with more acute manifestation of disease, it really is a easier place to discover what is effective and what isn't. Because if it's not effective, it's there in your face. If somebody comes in with a mild condition and it's a bit, they're not even sure what it is, they feel uncomfortable or they're not satisfied, then these are much more difficult to pin down. But if you're treating acute conditions, and you can escort them from that acute stage to a stable equilibrium, then you see the strength of Chinese medicine.
Yes, and you learn faster.
Mm.
Yeah. Now, you've been treating, you said recently, more inflammatory disease. You've been paying attention to it, allergies. One of the things that I've certainly noticed, and I think everybody's noticed in the past few decades, is dramatic increase in allergies, food allergies in particular. I'd like to get your thoughts on that.
Yeah, I mean, there's an increase not just in allergies, but in autoimmune disease and allergic disease. If we talk about in atopy, which is allergic disease. So in the 1960s, in the UK, and I expect this pretty much the same in the US, they say there were about 2% of the population were atopic, which means they have a propensity to eczema, asthma, rhinitis, and allergies, food allergies. Today, the percentage is closer to 40%. So that's happened in 60, 70 years. That must be due to environmental factors. And I think it's not difficult to extrapolate and say it must be diet, it must be living conditions, it must be lack of or reduced movement that people do. It's the environmental factors. This is not genetics. So I think all these conditions are on the rise because people's lifestyle is poor. When you look at the Neijing, you read the chapters in the Neijing where it says, why was it that in ancient times people lived to a long, productive life, and why is it nowadays people are falling by the wayside earlier? Really, they had it all then. It's people wake up with sunrise and sleep with sunset, and they eat the right foods, and they conduct themselves in the right way. Their emotional state is kept within confines that our systems can cope with. I mean, nowadays things are so disrupted. I think also microbiome now, the understanding of gut microbes and so on, really points to that. If they're so easily influenced by the foods that we eat, then, and the immune system is, so much of the immune system really resides in the gut for very obvious reasons. That's where we introduce foreign substances to our body. Then, we've really taken a wrong turn by adopting a modern diet. It's a disaster. Just along those lines, when I first started practice, and I'd see colitis patients even in the olden days, I never ever saw a patient below, 20 or in their teens, certainly. Today, the largest cohort of ulcerative colitis patients, the largest increase is in the under 6-year-olds. So it was unheard of.
Under
Yeah.
6.
Or it may even be under 4. But it's, I see many patients now, children with this disease. So possibly antibiotic use because they're destructive to microbiome, as well as dietary factors. So it's turned upside down. Yeah.
Dramatically turned upside down. I'm going to ask a question, and I know it's a little bit inflammatory, but I'm going to ask it anyway. When I was a kid, we didn't get that many vaccines. I mean, we had a few. These days, kids get a dramatic amount of vaccines before they're even a year old. Do you have any sense if that might be playing a part in all of this? I know it's a really inflammatory topic, but I wonder. This is something that we've added in that's fairly new.
I think it's conceivable in order to tease that one out, you need millions of people and you need a lot of time to figure that one out. But vaccinations, in my mind, are a sensible way to treat severe and difficult diseases otherwise. For example, tetanus or smallpox. You wouldn't want to not have a protection. But when it comes to rubella and mumps, I think it's overkill. Because actually, if you're going to protect a child against those conditions, those childhood illnesses, then they will develop other diseases, maybe more virulent diseases as a consequence. It makes sense because we're not going to be immune to disease. That's I think, upside down way of thinking. You can't, to be alive, you need to one day die. To be alive, you also become prone to illness. Your immune system needs to fight that illness. And yes, these early stages of coming across diseases for a child are crucial. And just to protect them willy-nilly against relatively mild disease doesn't feel sensible. Against severe disease, yes.
Yes, for sure. I like to keep my tetanus boosted on a regular basis because, I'm cutting myself and, all kinds of things. You certainly don't want that. There are certain illnesses, for sure, you don't want them. It's interesting to think about other illnesses, let's call them more mild childhood illnesses, chickenpox, measles, that kind of thing.
Measles may sit on the fence with that one. I mean, I wouldn't want a child of mine to get measles because the consequences can be severe. But chickenpox or rubella.
I'm sorry, I conflated rubella and measles. The more mild ones. I'm wondering, and again, I'm thinking as a Chinese medicine practitioner. I'm thinking as a person who looks at a human being like I would look at a forest or a garden or a landscape. Sometimes you need a fire to burn through a forest and get rid of the brush so that you don't get a giant fire burning down the entire forest. And I wonder if some of what we're doing in suppressing some of the more mild illnesses are leading to more severe and chronic illnesses later in life.
Yeah, I think there's a lot to that. I mean, I should just say with rubella, for example, if a girl hasn't acquired rubella naturally by the time she's entering puberty, then maybe the vaccination then is valuable. Well, not maybe, I think it would be valuable just because if a pregnant woman gets infected with rubella, then the consequences are severe. So we can be smarter about how we apply vaccinations, I think. And there is an imperative, isn't there, to maximize. Maybe pharmaceutical companies are happy to create lots and lots of vaccines against every ill, but that does not make sense in the end. You can't protect yourself against life.
You can't protect yourself against life. And sometimes life involves illness, and sometimes those illnesses bring us a kind of benefit, brings us a kind of strength. I think about just even dealing with things like anxiety as a young person. Like if you can learn to handle your anxiety as a young person and work through it or work beyond it, it makes you a much more robust adult, right? There are things that challenge us as human beings that are maybe in some ways for our benefit if you look at the longer picture.
Yeah, I think that's so obviously true. And your metaphor of the forest fires and smaller forest fires, preventing the massive ones that can occur if you don't clear the brush. I mean, that's people's experience, isn't it? If you come across things in life and you overcome them, then you become stronger. If you're always closeted and protected, then you become weak. I mean, that's obvious. We see it all around us. So, yes, I think we've solved it, Michael.
Well, again, we've got all these great theories in Chinese medicine. We've got metaphors that can be helpful when applied at the right time in the right way. So there's that. But of course, then it's, every individual case and what we see. So what is it? There's that thing about, and I'm going to completely slaughter this. You said it basically, that the important thing is practice. And the theory should serve the practice. Practice should not be a slave to theory. So there's that. So Mazin, this work that you do with the dermatology, it's certainly a gift to patients. And it's a gift to our medicine as well, because it demonstrates the efficacy and the potency of Chinese medicine in very dramatic ways, right? You can take pictures on day 1, you can take pictures on day 40, or even take pictures on day 20 and often see some results. That's powerful. You teach in Europe. Are you also bringing this to the United States, or?
Oh, yes.
If somebody was interested in learning what you're doing, how would they go about it?
Yes, since 2016, actually, I've been running this dermatology course, which is a 15-day course run over about 8 months. So 3-day weekends every 6 weeks or so. And I go through the 20 most common skin diseases. But prior to that, the concepts that are really important to grasp in order to understand how to use ingredients correctly in order to achieve those changes. And then going through those diseases and specifying and underlying the important features that you need to watch out for. So after I've been teaching this course, I think I've taught it 3 or 4 times in the US since 2016. And I run it typically in New York and on the West Coast somewhere. So I've done it in Oregon and in California. The next course actually I do is in April, both in New York, and I repeat the same thing because I usually have quite a lot of students in LA as well. And that's really a full training. Students who sit through the course and pass the examination at the end. I'm a believer in encouraging people to secure the information they've learned through study. Those who pass, and most people do pass, even though they may complain somewhat, become members of the ITCMDA, which is the International Traditional Chinese Medicine Dermatology Association. And it is international because by now we have about, I think, 250 members. We have a website where their names and addresses are posted. And as is the case, and this is across Europe, so we have members in Germany and Switzerland and Austria and UK and Ireland and all over the place, and Latin America and Canada. Then when patients contact my practice and say, can you treat me? I say, well, go and see one of my students close to you. I can't cope with all the patients I have, and this is a real easy way to spread the word as well. By now, we have a lot of very serious practitioners in the US. So yes, it's possible to study
Great.
with me coming up in April.
I'll put some information on the show notes page if people would like to learn to do that. I don't do dermatology as a specialty, but I do know this. Anytime you've got something that can help people and you help them, they tell all their friends who have that problem.
Yes.
It's not hard to build a good practice that lets you help lots of folks when you've got something that actually helps lots of folks.
But I think also if you specialize, you become much more aware of the significance of how you adjust the formula. And you can really use that method when treating other diseases. Certainly in my experience, in my practice, it's been a real boon that by studying carefully a discipline such as dermatology, and it's not to be sneezed at, there's 20 to 25% of all patients looking for treatment at outpatients is for skin disease. So that's a lot of patients.
Well, and like I said at the beginning of this conversation, I took your 2-day class. I came back to my practice. I noticed things that I didn't see before. And I've been able to help people with it. It's been very gratifying.
Yeah.
Yeah.
Yes, for sure. I mean, to study the lesions carefully and to understand what it is that you're seeing and not just see a kind of a red patch or a bit of scaling or a pustule, but to understand what that means and to understand how you can resolve that gives you a real understanding of how to apply Chinese medicine, not just for skin disease, but for other conditions. Yeah.
Well, and it's helped give me a window into what else is going on for a patient, and it's allowed me to help them with other things. So really, really helpful. Appreciate that. Mazin, thank you so much for your time today. And anything else you'd like to share with our listeners before we wind this down?
First of all, it's my pleasure, Michael. It's great chatting to you. I guess what's really important is to keep your nose to the grindstone. It takes a long time to learn medicine. I mean, decades. If you have access to a good teacher, then learn what you can from that, because experience is everything, especially in Chinese medicine.
Great. Well, until next time then, thanks, Mazin.
Great. Thank you, Michael. All the best to you.
I've noticed that skilled and effective Chinese medicine herbalists tend to have a sense of confidence, probing curiosity, and an ability to take mistakes or unexpected reactions and use them as a way to further refine their diagnosis and formulations. Experienced herbalists have a rationale for every herb in the formula. They don't add something just in case. They take a stand with what they see and aim accordingly. I found over the years that is a good practice, to go directly at what you think you see and know as you're weighing out the herbs that if you're wrong, you might see certain side effects. It's good training for both your knowledge and your spirit. In time, it makes you better at your work because you'll end up with confidence commensurate with your experience. And it helps to have some guidance, especially when starting out, because you need to learn how to navigate the difficult spots. And there are plenty of them. But it's doable in time and with effort. It's not for the faint of heart, but then neither is any path that requires you to put your heart into it. Well, here we are at the end of this episode. If you've listened up to this point, you're either a rabid fan of Qiological or the forward button on your podcast player stopped working. If you are indeed a fan of the podcast, you can help us to bring new episodes to our community of practitioners by supporting us with a membership or a one-time contribution. Details, of course, are on the website. That's it for today, friends. Join us again next Tuesday for another thoughtful episode of Qiological.